So what happens if someone with ATS is unable to get cross-linking?
Well, cross-linking isn't exactly 100%. Some of the ATS patients even learn Braille just in case the treatment doesn't work.
Whoa, I've never seen anyone use Braille before.
Well, let's get a look at Aiden. He's getting pretty good at it.
The reason we decided to start with Braille and learn it is because we didn't know how the cross-linking was going to go, and a family from Bermuda had already started it, and my mom thought it'd be a good idea to do it. Reading it is kind of like trying to read Morse code, and writing it is like just an analog keyboard, except it's with different signs and stuff like that. And the reason there's only 6 dots is there's only 126 signs for reading, and you just combine the different signs and put one after the other. Like a number would be dots 3, 4, 5, and 6, and then an A for 1, a 2 would be B. So if you want to put 12, you put 3, 4, 5, 6, 1, and 2. I feel like Braille has gone okay for me, and I can read and I can write it pretty well after only a year and a half, so I don't think it's too hard to learn, because it's basically writing part is just learning pretty much, it's like a more analog version of typing on a keyboard. And then reading it is basically, it's a little bit more complicated and requires you to be good at writing, but it's not too hard to get good at.
Wow, I'm starting to realize that ATS can be really difficult for the patients between the treatment, surgery, going to conferences, and now they have to learn Braille.
Right? It's not really just hard on the patient. The families have it difficult too. Let's hear from them and see what they have to say.
Hi, my name is Aaron, and my little brother is Aiden, and I've been dealing with the ATS my whole life, basically.
You know, a day in our life is normal, like any other 8.5-year-old's life. So second grader going on third grader's life. You know, school, playing around, iPad, normal stuff. I think that's the challenge with this. Is I look at Megan and I think she's very normal, and then you come to an event like this, or you have a doctor's appointment, and the reality sets in very quickly.
My wife is very good at taking care of juggling a family and my daughter with her medical conditions. So she is the backbone and does a great job.
Probably the scariest thing about ATS that's ever happened to me is whenever Aiden's lungs collapsed whenever I was 6 or 7 years old.
Doctor told us that she had ATS when she was about 3.
Megan was diagnosed very early. She was about 6 or 7 weeks old, and it all started with a heart murmur. And
sometimes I have to miss out on a lot of school because we have to go to Arkansas for doctor's appointments, and I have to catch it all up.
And then I have to a lot of times take care of the other kids while she's doing Maggie's doctors, and sometimes the kids get pushed off to the side when there's too much going on with Maggie, and we have to remember that our kids need attention separately.
But I remember him going into the hospital and me being really scared about it.
Our lives changed because the center of the family has sometimes become Maggie's disease. So we have to make decisions for everyone on what's sometimes best for Maggie versus the family. And it's not always the right decision, but it's the best decision for Maggie's disease and how we can make things better for her.
Geneticists, and I think we saw every type of doctor in her first 3 or 4 months of life.
She goes to my school, but she has a lot of special needs things there. Sometimes she has she'll have to go in like a special room to help her read and stuff.
One thing that I'd really like to do with Aiden is I would like to go to an amusement park and ride roller coasters since it's really straining on Aiden. We can't really do that, so we have to find different options to do that.
Sometimes she'll yell at me and say, "I'm fragile, you can't touch me like that." We know that she's fragile, but it's weird how she knows she's fragile.
Not all of it has been absolutely negative, but there has been a lot of positive, like some relationships with doctors and new places we've gone to and fun places we've gone to, so there's a lot of positives.
We had a lot of fun with other people who could be different.
I'm really proud of my mom because she started the nonprofit and she worked really hard and it was really slow at the beginning and she pushed through it and she sacrificed a lot and now she's helping a lot of people. I'm really proud of her. My advice for someone that has a sibling with ATS would just be to stay calm and remember that they're gonna be okay.